This works is for the 30-year-old to maintain. Remember, I've said this before in one of our previous podcasts, after age 18, we lose 1% per year of collagen. Now, at 30, that means you've already lost 12%. Welcome back, beautiful people. This is Forever Young. I'm Dr. John Layke.
And I'm Dr. Payman Danielpour.
Thank you so much for all the feedback that we've received. We hope that we are teaching you something. We really love the emails and questions and things like that, just because it makes us think that we are teaching you something and you're learning something. So today we have a special topic, I think, that's really got its popularity here in the news recently. And it's kind of like the Kardashians will always amplify something that's been around for a little bit. And so this is no exception. This is the Morpheous8 by a company called In Mode Aesthetics. And so we'll talk about it today. We'll talk about, who's a candidate, how it works, what our recommendations are, and is it right for you?
And the reason we're talking about this now is because lately, more than ever, like Dr. Layke just said, it has been on the forefront of the world of beauty, cosmetics, social media, and Kim K. A good buddy of ours, Dr. Ashkan Ghavami, had Kim Kardashian in his office, and she promoted the fact that she had Morpheous8. And since that, we have had the phone just blowing up with people asking us, do we have this? And what do we think? Mm-hmm. And to be honest with you, we were one of the first practices probably in the country that had it, because we've had a really good relationship with InMode for years. We were instructors for the body tight and the face tight. And we really were on the forefront of the technology when it came to radio frequency assisted liposuction or even external radio frequency treatments. So therefore, when this first was brought into the market, they obviously brought it to our office and we loved it. We have been using it for multiple years now. We use it for the face and body, and we're going to tell you how it works, when to use it, why to use it, and why we think it's one of the best non-invasive procedures in the market right now.
Mm-hmm. All right. So what is it, first of all? So imagine that there's a little handpiece that is shaped like a gun almost, and what it's used is a tiny 24 little needles, 24 little pins that essentially can be controlled at a certain depth. So 2, 3, and 4 millimeters. Now you may say 4 millimeters sounds like a lot. It is, and so it's used judiciously in certain areas of the body. But we also use that on the body where skin's a little thicker and things like that. So now, in addition to just the trauma of the needles penetrating the skin, we also deliver radio frequency, which is the electrical form of heat. Now, heat-based technologies do one thing. They cause contraction. Contraction by denaturing proteins that are both in the skin, subcutaneous tissue, muscle, anything that it hits, and will essentially cause that tissue to contract. So I'm sure you've seen the ridiculous Instagram videos where people are using RF technology and they're kind of heating up a grape or a piece of chicken or something like that. It gives you an idea of what radio frequency can do. Sometimes it's a little silly, but it will show you what it does with the tissue. Now, in live human skin, obviously it treats things just a little bit differently, but imagine that the skin and subcutaneous tissue, the fat, there are tiny little fibrous bands that are within them. And so what happens is you emit radio frequency and it tightens those bands, and that will tighten the layer of skin. Sometimes it will destroy some of the fat cells, and it certainly will stimulate collagen production.
Absolutely. So what does this mean? Why do we care? Why are we going to use it? When we first had this brought to our office, why were we so excited? And there are multiple reasons. And one of the main reasons is that first and foremost, it works. Second of all, it has minimal to no downtime. Third of all, it can be done under local numbing medicine or local anesthesia, so therefore you don't need to go to sleep. Now, and it can be done face and body. Now, The concept of microneedling has been around for over 20 years. And initially, the studies that were done were on a rat, and it showed by taking a roller or dermal roller. That was the first study that was ever done. I remember this clearly in a journal club that we did in residency. And you did it on a rat's belly, and you did it on the other side. It showed that the collagen production from rolling needles on a belly was significantly amplified. So this was then taken, and multiple other studies were done showing that taking a small pen that has little tiny needles on it and poking little needles in the face, for example, can cause a significant amount of collagen production. That basically is our holy grail in plastic surgery, because we're constantly trying to keep up with the loss of collagen and elastin. That is one of the main reasons we age. That is one of the main reasons that skin sags, that the breasts sag, that your lateral thighs or medial thighs or any part of your body that sags. It's because of loss of collagen and elastin. So if we know we can keep up with it even at a small rate, then wow, let's do it. So microneedling has been done for a while. Interestingly enough, Kim actually really made it very famous back in the day when she did her first vampire facial, where we took a microneedling pen and poked holes all over someone's face and then put PRP, which is platelet-rich plasma, put that on there and then drove that into it. Now, what's the difference between Morpheus and just PRP?
The difference between Morpheus is, again, adding that radio frequency. It's that heat-based technology. And so, the PRP is great because platelet-rich plasma will allow those growth factors from the platelets to amplify whatever signal is there. So when you're traumatizing the skin, we know the collagen production is going to happen. You imagine, even in a wound, you cut yourself, platelet goes to the scene, stops the bleeding, and then emits all of these growth factors for healing. So you know that collagen is going to be stimulated. So we use that basis of science to say, okay, well, if we know that's going to stimulate collagen, let's just make sure we do it without scarring, poke some tiny holes, and then deliver heat. That alone, will amplify the collagen production and healing process anyway. So could you do Morpheus and PRP? Of course, you definitely can. But the idea is you would be using it more for its anti-inflammatory properties than you would for amplifying the collagen production, because the heat does it on its own. So the interesting part about this technology, because it has changed over the last several years. Originally, it was the 2 millimeter was really for resurfacing. So it was very superficial type of treatment. And so you'd get some peeling, and it really kind of takes off the dusty layer, something similar to a CO2 laser, at least a component of the CO2 laser. Then was between 2 and 3 millimeters. 3 was a little deeper. 4 is they started to add so we could start getting submental. That means under the chin on that neck area, because we wanted to start essentially frying some of that fat. And so you would essentially destroy some of the subdermal fat. Now it goes up to 7 or 8 millimeters, and that's really for the body. That's because that skin is so much thicker. So if you think about the potential to treat stretch marks, the potential to treat the crepiness of the skin above the knees, you think about the crepiness over by the elbow. These are all areas that can be tightened. Now, in our experience, people ask, is this, so why don't we go over how long the treatment takes? Is there numbing required? What is necessary? And say, what's the downtime? And then what are the recommendations for how many treatments you need?
Sure. And it can vary depending on your practitioner, but generally speaking, we'll start off from head and we'll go down all the way. Because we do these facial procedures regularly in our office under numbing cream. We normally have people numb for about 45 minutes to an hour. Mm-hmm. We have an amazing numbing cream that truly, truly works, and people tolerate it really well. Most of the people that do their face, they do their neck as well. Mm-hmm. With that said, what are we trying to do with this procedure for the face? It's a bunch of different things. For some people, they think that by getting contraction around the forehead, the brow can elevate a little bit. If you do it around the lips, you can have the wrinkles that are around your mouth get a little bit better. All along the cheek, there's a lifted, more more fuller kind of look to your face. If you look at some before and afters, some of these even look like they've really had surgery done or filler done, but really all it's doing is just collagen production. Same for the neck. Some of the horizontal lines on the neck, it can really help fill those areas. We recommend it anywhere between 4 and 6 weeks. And the reason we do that is it normally takes about 6 weeks to get collagen to be produced. So we want to stimulate it as much as we can. And we normally say 3 times. There are some people that will push it 4 to 6 times because they do think the more they do it, the better. The caution here is you have to realize, like Dr. Layke just said, you can get a little bit of fat loss the deeper you go. So you have to be with a practitioner that really knows what they're doing. Go superficial in areas that we don't want to lose the fat, because there are areas, especially if in older men and women, that you want to keep some of that fat. You just want to resurface on the surface, but then there are areas that you do want to get rid of the fat. So basically that's what it comes down to the face. The downtime, depending how many passes we do, we normally do 2 to 3. The downtime could be a day or 2. Obviously the post-procedure protocol is different for a lot of people. Some people are using PRP. Some are using exosomes. In the future, hopefully soon, we'll be using stem cells and a variety of other products. Most of the time, you just really want to moisturize your face because it's going to need that. It's going to want that because there is a resurfacing kind of component to this.
Sure. I mean, it's trauma to the body. And so what I would say is we'll give you examples on areas that we can treat, things you're not thinking of that I think are very effective. And I've already touched on a couple of them. I did want to say that this can be used for any skin type. So this is, when we talk about using something for their 6 different skin types from, very, very light skin, blue-eyed redhead to dark black skin. And, sometimes we have to be careful with certain lasers because a lot of heat-based technologies can cause post-inflammatory hyperpigmentation. And so we obviously want to avoid that. I think that as we start getting into the higher skin types, as far as darker colors, that we like to pre-treat them with that Triluma. But, the good part is this is a procedure that can be done on any skin
and
type.
It's really important, this part of this, because that's why the Morpheus is it's getting so much attention right now, is because unlike some of the lasers that we use, you can't use them on darker skin tones because you will get some major post-inflammatory hyperpigmentation or even hypopigmentation. And that just means you can get areas that will become darker or lighter. When we say pre-treat, we like to pre-treat with something called Triluma. It's got 3 different things in it. It's a cream that we like to use on the face or the body if you're going to have any type of laser procedure or heat-based type of procedure. And it's got retin-A, a steroid, and a whitening compound in it. And it really has been shown through many studies to decrease complications after heat-based therapies or lasers.
Sure. I was going to give a couple examples of where I have used this and we've seen some great results. Natalie, our aesthetics nurse, does a great job of this. I love that she's so aggressive. And, when you come here, you're going to see a result. But this is just as effective for the 70-year-old female that does not wish to undergo a facelift or neck lift. And what it will do is it will tighten some of the skin. It's interesting because sometimes when you lack the amount of collagen and elastin as younger skin, it works even better because you can see that tightening. You may require more than the 3 sessions. I mean, listen, I'm not going to lie. I think with more excess skin, you're going to need more treatments. So maybe you start thinking about 4 to 6 treatments, that would, at least for those people who do not wish to undergo any type of surgical procedure. The second area this works is for the 30-year-old to maintain. Remember, I've said this before in one of our previous podcasts, after age 18, we lose 1% per year of collagen. Now, at 30, that means you've already lost 12%. So think about what happens as a decade goes by. So if we can stimulate collagen and preserve and hold your age for several years, the aging process slows. So for a 30-year-old that's just looking to maintain, I think this is a great treatment. One area that people forget about is the hands. The hands, besides the neck and certain aspects of the face, but the hands are a dead giveaway on our age. And so this is an area where we can dial down the depth of the needle and do 2 and 3 millimeter, and you can get amazing results. Now, as you age, you lose fat, subdermal fat in the hands, and so we can also add filler or fat or something like that to give that plump appearance. But the skin itself, we need to be less crepey. So the idea is we can do this on the hands. I know you have recently done some on certain body parts. Where have you seen some of the best results?
So very commonly you'll get people that are in their 40s, 50s, 60s that come in, and like you said earlier, you kind of hit on it, around the knees. Oh, it's getting a little crepey. They'll come in, they'll say, you know, I don't want to wear a bathing suit because my skin looks so wrinkly or so crepey. The arms, you know, not everybody wants to undergo surgery. So not everybody wants to have either liposuction or brachioplasty or medial thigh lift or these big operations with big scars. They just want a small improvement. Now, I'm not saying Morpheus just gives a small improvement, but it does really, really make a difference. You can do them anywhere where you see that there's crepiness, up and down the inner thighs, on the anterior thighs, the lateral thighs. What I love using it on is the abdomen. Post-pregnancy mommies that have just a little bit of crepiness. They don't need a tummy tuck. They just want it to be just a little tighter. It has been a go-to procedure in our office. We see a lot of post-pregnancy patients that just want a little bit of tightening, you know.
I agree with you. I had 2 patients. Sorry to interrupt.
No.
I had 2 patients that I thought for sure would require an abdominoplasty. They were right on the edge, but I thought they're just not going to get a good result with just doing liposuction and Morpheus, or with just doing liposuction. We added Morpheus on top, and I'll tell you that it really helped tighten the skin. I was pleasantly surprised in both of these individuals, and they are happy as all get out because they've, you know, it obviated the need for a large scar underneath the underwear.
You know, you took the words out of my mouth, because sometimes it actually is even better. So if someone's coming in for surgery, and you know this, I almost always add a Morpheus procedure to the breast when I'm doing a breast lift, because most of the time you do a breast lift, the skin has stretch marks. It's a little bit thinner. You want to thicken that skin. It's been a go-to. So I'll do one procedure in the operating room, and then 6 weeks later, Nurse Natalie will do another procedure, and then 6 weeks later, do another procedure. We also will treat the breast scars, and we'll talk about how we treat, you know, scars with Morpheus as well. Other places like, you know, the tail of the breast. Some people say they've got that little puffiness. Now, when you combine surgery and Morpheus, it's even better. So somebody that comes in with a little bit of skin laxity of their arms, let's say, or the tail of their breasts, or their thighs, or their belly, anywhere, do radiofrequency assisted liposuction, which is body tight by end mode. Really get in there and cause the same type of heat contraction, but under the skin, and then treat the skin itself with Morpheus. So you're tackling it in multiple ways. And I've seen, like you said, incredible results where patients that come in that you would think need a tummy tuck, but you literally give them so much skin contraction with technology that they really don't need that scar for a tummy tuck, and it makes a very big difference. Now, again, by combining it, it works. And sometimes all you need to do is the Morpheus. And some people say, listen, I don't want to have surgery. They do the Morpheus, and most people really see such a difference that they love it. And they just do 3 sessions, sometimes 3 to 6 sessions every year. They come back every year and do it. They feel like the downtime is minimal, the pain is minimal, and it's a lot easier than undergoing any type of surgical procedure.
You know, I agree with you. With all the body parts that you've listed, the one thing that, you know, again, I'm not going to say that it treats entirely, but it does improve our areas of cellulite. The idea, we know that it's, you know, almost impossible to fix, and there's so many different new treatments. We've talked about Quo in the past with one of our previous podcasts, but the idea is that if you can get a tightening of the skin, you may not see as many of the dimples from the cellulite. So again, I'm not saying I don't want this to be like this is our Windex or our, you know, our duct tape, but it isn't a solution for everything. But I do think for improving the quality of the skin, both face, neck, and body, that this is, you know, it's an amazing technology, and I think we use it well.
Now, the other thing we like using it for is for scars. And in a future podcast, we're going to talk about how microneedling really helps scars. Now, again, remember, Morpheus is just microneedling, but just on steroids in a sense. Now, taking that scar that you're treated. For example, we treat thyroidectomy scars. So scars that are right literally underneath your Adam's apple can be a telltale sign that you've had surgery there. And for women especially, they just don't like it. You can't grow a beard over it. It just becomes this constant reminder that you had your thyroid removed. And some people don't heal as well. So I've had a lot of patients that we've treated over the years with Morpheus in that area. And it is such a quick and easy procedure. You literally can numb it up and do 3 passes and you're out the door. And you'd be surprised because all the scar is, if it's a poorly healed scar, it's just unorganized collagen. So if you can somehow do something to kickstart that collagen production in that area and make it more organized, that scar can heal a lot better. So C-section scars, thyroidectomy scars, any traumatic scars, any surgical scars, any scars that you have, Morpheus is an excellent treatment option. If you have darker skin, again, I would definitely pre-treat.
You have to imagine the mechanism of this procedure. The radiofrequency denatures protein. So if you've got a hypertrophic scar that's raised, what it does is it destroys some of that collagen, breaks it down, and then it can essentially rebuild in a more organized fashion. So we've seen some great results with that.
And like Dr. Layke said, now there is, due to the depth of the needles, that's how much it's going to actually penetrate the skin. So the shallower the needle, the more superficial, the deeper, obviously the deeper. Now, the deeper you go, the higher the chance of burning some fat. Now, what does that mean? Now, we can actually treat that to get fat reduction in some areas, but it actually can be detrimental as well. So the one thing that I do want to kind of make the listeners aware of is that if you have filler in your face and you're worried about that going away, then be careful with the Morpheus, because Morpheus can actually dissolve some of the filler if you go too deep. That heat-based therapy over an area of filler can eliminate the filler or melt some of it away. So, talk to your practitioner. Tell them if you've got filler in your cheeks, just so they don't go too deep or they don't do too many passes there, because it can melt some of that filler away. I would treat with Morpheus before filler and then get the filler after, because you may not even need the filler after Morpheus.
I agree with you. I recommend that all the time. I say, listen, let's treat skin first, then move into filling with volume, because a lot of times it will lessen the amount of volume or decrease the amount of volume that's necessary rather than trying to, fill as much as you can. So it makes everything just look a little more natural.
A couple other areas that just come to mind that I just remember doing for people is we love treating the banana roll. It's a tough area. So the banana roll is the little crease or pocket right under the buttock crease. And a lot of people come in and they say, I don't like this bulge there. Problem with doing direct liposuction in the area is there are some ligaments and retaining ligaments of the area that if you blow through them with liposuction, the buttock can sag. So instead, imagine if you can just tighten that skin and lose a little bit of the fat. I think Morpheus is almost perfect for the area. And again, remember, these things can be done under local anesthesia. So you don't have to go to sleep. If needed, it can even be numbed up with numbing medicine instead of just local topical. And this is something that, again, can make a difference. Now, if you don't believe us, go on the site. There's a site for InModeMD.com. They have some before and after photos that truly are unbelievable. But the people that are posting them are legitimate board certified doctors, that the plastic surgeons that I trust, that I know they wouldn't just put pictures up that are altered. So some of these, Morpheus really, really does work. I think it's something that if you can do it instead of microneedling, I think it's a little bit more powerful. Cost may be a little bit higher, but I do think it's really, really worth it.
Just some key takeaway points. This treatment really is for young to old, any skin type, really to tighten skin and stimulate collagen. Downtime is probably 2 days. You can start putting makeup on as necessary. You just look a little red. As far as seeing the results, Takes 6 weeks for you to truly see all of the results, just because that's how long it takes to stimulate collagen. We recommend at least 3 to 4 sessions each 6 weeks apart. If you do have excess skin, you may need 4 to 6 sessions. As far as cost, sometimes it's $1,500 per session. Sometimes there are packages. Again, it all depends on the areas as well. I mean, obviously larger areas take more time. You go through a few of the needle cartridges, and so that may cost more as well. But I do think it's a good alternative for those of you who don't want a surgical procedure. This is something that can be done with local topical anesthetic. Hopefully you have learned something today. Once again, this is Forever Young. I'm Dr. John Layke.
And I'm Dr. Payman Danielpour. You can listen to us on the Apple Podcasts, Spotify Podcasts, or wherever you listen to your podcasts. Peace.